Hi, this is Bob Roth, Managing Partner and Co-founder of Cypress Home Care Solutions. Since 1994, we have been providing in-home supportive care services for our older adult population right here in Phoenix, Arizona. Since 2014, we've been bringing you a show on Money Radio called Health Futures, Taking Stock in You. In case you miss our show that airs every Friday at noon, you can catch it right here on our podcast called Health Futures, Taking Stock in You. So when you get a chance, listen in and enjoy the show.
The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers and do not represent an offer to buy or sell any securities.
It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and we're coming at you live from the Scottsdale Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. We're also podcasting now, and you can catch us on Spotify, you can catch us on Google, or you can catch us on Apple. Catching up with the times. If this is the first time you're tuning in, our show is about how our older adult population can live a healthier, happier life. How do they do that? They do that by tuning in right here, not listening to me, but listening to these extraordinary guests that I get to come on the show. So I've got a repeat guest. She tells me this is her third time here on the show. So I'm really pleased to have Ann Wheat, Executive Director of DUET Partners in Health and Aging. Welcome back to the show.
Thank you, Bob. I'm so pleased to be here.
It's really good to have you here on the show. And, you know, you are certainly a breath of fresh air, a light in my eyes because of the great work that DUET does here in our community.
Well, thank you. And DUET has been doing that good work for 42 years now in the community, and it's a real pleasure to be part of their journey.
So if you wouldn't mind, to tee it up for our listeners, even though you've been here before, if you could just give us a quick brief on DUET and the 40 years of being a change agent and making a difference. I know that it was born out of the Church of Beatitudes. Let's start right there. Dosha Carlson, who, God bless her, she left us two years ago, I think it was.
Yes, 2 years ago.
But she left us such an incredible legacy. So please do share.
She certainly did. She was a really special human being. DUET was founded actually in 1981 by the Reverend Dr. Dosha Carlson, who was a pastor with Church of the Beatitudes, and she really recognized through her work, she developed a deep concern for who she called the invisible elderly. She'd seen the conditions elderly people were living in various facilities and all. And so she set out to do something about it and founded this organization, this precious organization, to bring health and well-being through vitally needed services provided free of charge to various vulnerable members of our aging community. And that includes about 2,500 people a year who are receiving services. Wow. If they are homebound adults and they can't get out and drive, they get help with so many things from our caring background check volunteers so they can successfully remain in their homes where they want to be. Everything from transportation and medical appointments to shopping, help with paperwork, friendly visits. There's just so much. They also support, DUET supports services for grand families or kinship families. So those grandparents whose children are not able to parent their grandchildren, and late in life they take on the care of children who are often so traumatized. And we tend to support those grand families who receive no support as formalized foster care families.
The numbers are staggering.
The numbers are absolutely...
It's over, what, 30,000 in our state?
It's over 60,000, I believe, in our
60,000.
state.
Wow.
And about 70 to 80% of the grand families we serve receive no government assistance. So it's up to DUET to help them navigate that journey. We do that in partnership with them. One person helping another is our model. And then lastly, we do a big amount of support for family caregivers, including running almost 30 support groups every month, peer mentoring, workshops, so many things, webinars, teaching them the skills they need and giving them the support and community they need.
Well, I mean, I'm glad you landed on the family caregivers. They are the silent army out there making a difference. We're talking about 54 million Americans making a difference in the lives of loved ones, others, friends, neighbors. They don't necessarily have the tools to be able to do it and do it right. And I think that's a great segue to what we want to talk about today, right?
Absolutely.
So let's talk about it. You got a big event coming up, and what's great about this event is that you don't physically need to be there.
That's right. One of the signature events that DUET offers, and it's been very popular since we started it about 6 years ago, is our Family Caregiver Symposium. We do it virtually now just to give access to so many more family caregivers who may not be here locally or may not be able to get out of their homes and come to an in-person event. And it's our chance each year to bring in internationally renowned speakers who these family caregivers would never have the opportunity to learn from. And they come in and they share their wisdom, their expertise, their insights in a longer, deeper conversation. There's time for questions and answers, but it's really a meaningful time together. And we offer it free of charge to family caregivers, and professionals are welcome to join and often do for $15. That helps just cover our costs.
Well, I've attended these when they were in person, and if there's something that really came out good from this pandemic was the fact that we figured out how we could connect with others. And not only did we figure out, but families out there figured it out too. They were forced to utilize technology to connect. Zoom, Google Meet, Teams, you name it, we figured out how we could do things virtually.
It was a really tough time and also an amazing opportunity to learn and figure out what we were doing right and where we could do things differently. And DUET has always been an organization that cared very much. It's about one person meeting another one as an equal and helping in a very respectful way. That's been our history. And so it's not an either or. We still do offer some in-person activities that are helpful for family caregivers who prefer that. But we do a tremendous amount virtually. And this Family Caregiver Symposium is a perfect way to connect with hundreds, really literally hundreds of family caregivers out there.
And you have two people that are leading it. Usually we have one, but we have not one, but we have two. And we actually have one of them on the line here. So I'm going to let you do the introductions. Why don't you first talk about Dr. Robert Wicks, and then we'll introduce our special guest.
Well, we have, two speakers, one who I'll introduce in a moment. New to our symposium is Dr. Robert Wicks. He is speaking on the resilient caregivers, recognizing, preventing, and limiting the dangers of secondary stress. So we all know, those of us who've been caregivers or work with caregivers certainly understand the high impact that stress can cause and that it is often present in the caregiving journey. And so he'll be talking about the resiliency that caregivers have. And it's important for family caregivers to remember that they are resilient people and they can learn strategies that will help them to lower their stress and navigate that journey. Dr. Wicks has quite a background in this arena. He's written something like 60 books.
Wow.
And then, if I may.
Yes, you may. And I just want you to know we have less than a minute, so just
Okay.
why don't we tease it, and then
All right.
we're gonna bring the guest in on our second segment.
We will. We'll be introducing Dr. Aaron Blight, who will be joining us back by popular demand. He'll be joining us for his second time with us for our Caregiver Symposium.
Yes, and Dr. Blight, if you could just give him a quick, just brief overview. He's going to teach how caregivers learn, a pattern of role of development. Sounds like he's going to give caregivers tools so they can put them in their tool belt to be better caregivers.
Yes, and he'll explain more about that. But it's going to be a wonderful opportunity to learn from him. And so he's an international speaker. He's written a bestseller book for caregivers, and he has a lot to share.
Well, you hear the music. We're down one segment, but I do want to give a big call out. To register, go to duetaz.org/symposium. And we've got Jamie West from KTAR 92.3 as Arizona's Morning News. She is going to be the moderator. It's going to be a great, great event. And by the way, you can call George Burson at 602-274-5022 at extension 139 to sign up. You're listening to Health Futures, taking stock in you. Got a little Who taking us out here on a Friday the 13th. And we're talking DUET, and we're talking Family Caregiver Virtual Symposium. Stick around. We're going to get a chance to meet Dr. Aaron Blight and hear a little bit more from him about what he's going to talk about on October 18th. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and if you're just tuning in, I've got Ann Wheat here in the studio with me, and I've got Dr. Aaron Blight coming in through technology, through telephones, and we're going to introduce him here in a second, but I just want the listeners to know, if you want to learn more about DUET, go to DUET, DUETAZ.org to learn more about them. And Ann did such a great job teeing up our first segment, talking about the great work that they do, and you can catch our first segment if you missed it up at cypresshomecare.com. Click on the media button, radio shows right below it. So, and I'm going to give you the honors to introduce our special guest today, who is going to be presenting at the Family Caregiver Virtual Symposium on October 18th, 2023, from 9 to 11:30 a.m. Mountain Standard Time. That's Arizona time.
Well, thank you so much. It's certainly my pleasure to introduce Dr. Blight. We got to know Dr. Blight last year, as I mentioned, through his presenting at the symposium, and he's continued to be a supporter of DUET's work, and we really appreciate that. Dr. Blight has been in the field, in this industry, for over 20 years. He has been personally a family caregiver, which I think he might share, and he speaks to groups all over the world about caregiving. And he has written a book called When Caregiving Calls, Guidance as You Care for a Parent, Spouse, or Aging Relative, that received a 2020 Best Indie Book Award in 2021. He has, I think, just a wonderful style of sharing in a compassionate way his wisdom and expertise, and I think everyone's in for a real treat. So with that, I know they'll enjoy hearing from Dr. Blight.
Welcome to the show, Dr. Blight. Are you there?
I'm there. I'm here. Can you hear me?
Oh, I can hear you loud and clear. Just wanted to make sure we got you. So glad to have you here on the show. And how did Ann do introducing you?
Oh, she warmed my heart. Thank you so much, Ann. That was so kind.
Well, I
just have to say that I love DUET, and I'm just honored to be able to return this year as part of the Family Caregiver Symposium. I've been looking forward to it, and I just love being a part of your organization, being mission-driven, and for all of the right reasons, trying to lift and help and support family caregivers. It's a noble work that you're involved in.
So true. So true. And as I teed up our show when we were talking about it, there are 54 million of them out there. 54 million people that are giving up a lot in their way, their own lives, to help the lives of the people they loved, or the people that they love, the people that they adore, the people that they want to help along the way. And I love the fact that DUET's been putting on the symposium. How long have we been doing this now? It's been years.
Yes, it's been about 6 years now.
6 years. And I know we started it with Dr. Pauline Boss.
We did. She was our very first speaker.
I know. And
It's quite transformative to
it
the work
was.
we've done.
And look at how we've evolved. And, you know, I really would love to do a little bit of digging here with you, Dr. Blight, and really talk a little bit about what you'll be presenting and what you'll be discussing, and how will you be laying the foundation and giving the tools for these family caregivers.
Sure. Well, thank you, Bob. I appreciate being here with you today. And I think putting this a little bit in context, it's probably important for your listeners to understand, as Ann said, I have been a family caregiver. Family caregiving entered our lives at an unexpected time. We had a young family. I was 29 years old when my mother-in-law unexpectedly got a brain tumor, and she was told that she just had weeks to live. They recommended immediate brain surgery, and she had that. She had cutting-edge brain surgery at Johns Hopkins University, and the extent of our thought process was, well, Mom needs help. We're going to help her. And she needed a place to recover from her brain surgery, so she moved into our home. And as it turns out, she lived 5.5 years after that brain surgery. She was a miracle, but she was also in a state of steady cognitive decline. And so we were thrust into the family caregiving roles, and it transformed our family. It transformed my career. After she passed away, I opened a home care company, and it was there serving thousands of families throughout the Shenandoah Valley of Virginia that I realized how universal family caregiving is, but at the same time how intensely personal it is. And I went back to school. I got my doctoral degree, and I'm not a medical doctor. I want everyone to understand that clearly. My doctoral degree is in learning, and I use a learning-oriented lens and apply it to family caregiving. And so what I am going to be sharing at the DUET Family Caregiver Symposium is really about the pattern of caregiver development and how a family caregiver who is not innately endowed with the ability to be a family caregiver can actually learn and grow into the role.
Love that. And you know, you said you were running a home care company, and I'm just doing a quick dive on your background, and you know, that's what we do, and you know, you were part of the Home Instead organization, right? For it looks like for about 9 years, and then, you know, looking at your background, you were with the Centers of Medicare and Medicaid Services too. So
that's right.
I marvel at your background. It sounds like, you know, you were meant to be here in this space doing the work that you're doing.
I do feel like it's a bit of a calling, Bob. It's a labor of love. And after I got an unsolicited offer to sell my home care company, I had to kind of take an inventory of my life and realized that between the family caregiving, the caregiving policy at the national level, the business of caregiving, the study of caregiving, I just had to do something with that. I couldn't just put that on the shelf. And so for the past 6 years, this is what I've been doing. I speak to family caregiving groups and also care organizations.
Well, you know what? I know that you can empathize with me, having run my family home care agency now for 20 years. It's a labor of love. It's not an easy job. And looking at the fact that you were serving 9 counties and 3,000 square miles, that's quite admirable. It really is. And you get what these families go through, and it really is a challenge. I mean, look, we're not only providing care for those that may not have a partner or family member nearby. We're the one thing that we do, and you can relate to this, is we're respite for that primary family caregiver.
Absolutely.
And
yes.
When I talk to families, and when I'm talking to them on the phone, or when I'm visiting them with them in person, that is the person I'm really talking to. Because look, the person that needs
Right.
care, we can care for them. I worry about the one that is healthy, because you and I both
Yeah.
know that without assistance from the outside, 63% of the time the caregiver predeceases the care recipient. So they need that assistance. They need assistance with someone helping with those activities of daily living, but at the same time they need assistance gaining the tools and the knowledge and the skill sets to care for their loved one in that place where
Yeah.
they want to be, and that's home.
You're absolutely right, Bob. And there's so much focus on the tasks of caregiving because, it's a never-ending to-do list, and family caregivers can get overwhelmed at everything that they have to do. I find that often they don't have time, or they don't take time to reflect on how caregiving itself is changing them. And it's changing their way of thinking. It's changing the feelings of their heart, and it's changing in many ways their identity and their view of the world.
Right.
And so, what I try to provide to family caregivers is some new ways of thinking about the care experience. And I find that if you're able to adjust your mindset, that oftentimes the tasks are a little bit easier to bear. Can I mention one thing, Bob, that I just on my mind, because I know that you're out there in Arizona, and my grandparents retired in Sun City West, and so I remember days going out there with them and visiting them and seeing the population there in Sun City West. And I know that your home care business is very busy.
Listen, Aaron, we've got a break here. We're at halftime, believe it or not. Halftime here at Health Futures. I've got Ann Wheat and I've got Dr. Aaron Blight in the studio. We'll be right back. I hope you're enjoying the show. This is your host, Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. If you have any questions about the topics that are discussed during the show, visit us online at cypresshomecare.com or give us a call at 602-264-8009. We are entering now the second half of our show, so stay tuned for more helpful information to assist you with your aging loved ones.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and if you're just tuning in, I've got Ann Wheat from DUET. She's the Executive Director and Partners in Health and Aging. And I've got Dr. Aaron Blight here in the studio, and he is going to be one of the speakers at the Family Caregiver Virtual Symposium on October 18th, 2023. And that is from 9 to 11:30 Mountain Standard Time, which is it's kind of tricky. It is still Pacific Standard. You see, we never change our clocks here. So from 9 to 11:30, and you can get to this by going and registering at duetaz.org/symposium. Or you can call George Burson over at 602-274-5022, extension 139. So when we left off, we were just meeting Aaron, Dr. Blight, from I think are you in Virginia now? Is that where you're at?
Yes.
All right, in Virginia, we were talking about this program, and we were learning a little bit about him, and he and I share something in common. I still run a home care company. He used to run a home care company. he's great pedigree. He's got, some really incredible experience, really beginning with working for the Centers of Medicare and Medicaid Services, otherwise known as CMS. And you were sharing with us just before the break that you had an in-law that lived in Sun City, and I think you were in a lot of ways commiserating with me, understanding the challenges that we were dealing with, and I think that's where we kind of left off before the music came on.
Yes, my grandparents actually retired in Sun City, and so I spent a lot of time over there in that particular area, and just came to appreciate the demographics of the population there in Phoenix. There are a lot of older adults and retired, and home care business is an important business in that community, without a doubt.
It is for sure, no doubt. So, what I'd love to do is really have you take us through some of the things that you'll be discussing and really talking about at this upcoming seminar and obviously, or the symposium. Obviously, a lot of it is stuff that you actually learned and actually put into practice, and would love to have you share that with me and our listeners.
Yes. So I think that my caregiving experience was largely practical in terms of family caregiving, the business of home care, and policy oriented. And then when I went back to school to get my doctoral degree and started doing my dissertation research, I came across the work of two applied gerontologists, Dr. Rhonda Montgomery and Dr. Carl Kozlowski, and they studied over the course of some 28 years 28,000 family caregiver dyads, meaning the caregiver and the care receiver. I'm sorry, about 20,000 individual caregivers and their care receivers. And they started to notice patterns in the way that the caregivers felt about their experience. And those correlated with some of the health conditions and the evolution of the care-related needs of their loved ones. And so this research for me was very profound. It really dramatically affected the way that I saw the caregiving experience, because it really focuses on the social and the relationship dynamics and how a family caregiver feels in this emerging, evolving role of caregiver, because nobody trains you how to be a caregiver.
No.
The role is just thrust upon you. I like to talk about the way that caregiving enters your life. It's one of two ways, either the creep or the crisis. The crisis is what happened to our family, where a brain tumor diagnosis just suddenly put us in a caregiving relationship with my mother-in-law. But oftentimes it's more of a creep, where the caregiving role subtly enters into a relationship, and it starts very innocuously. You may not even realize that you're serving as a caregiver. Think about it that way for your loved one, because they might just need a little bit of help with bill paying or preparing some meals or doing some yard work. But over time, as your loved one's needs increase, you find yourself performing more and more caregiving tasks, and the actual performance of those tasks affects who you are in the relationship with your loved one. And so the nature of your relationship starts to change. And this can be very disorienting for people. And it also can cause you to have to spend your time doing things that you never had to do before, or maybe doing things that you really didn't want to do. And so it can be very hard to adjust to that. And caregiving is really a continual process of adaptation to the needs of the care receiver. And so in that sense, it is a transformative learning experience. And I like to look at caregiving as a transformative learning experience. So we're going to talk a little bit about the dimensions of that.
Nice. Nice. I love how you put creep versus crisis. It's so true. I mean, sometimes you do find yourself as a family caregiver, but don't really realize it. You know, you start running errands, you start checking in, and if you called someone out and say, "Hey, you're so-and-so's caregiver," they're going to say, "No, I'm not." Yeah, you are. You're enabling them. You're helping them. Not a bad thing, but that is what you are.
I think that sometimes can be one of the impediments to family caregivers seeking help. Some are resistant to even acknowledge that they're in a caregiving role now, or that their relationship has changed. And oftentimes, just that self-recognition is the gateway to supports that could really help you in your caregiving experience. And that's where DUET and organizations like DUET come in, because they are designed to help those family caregivers with these difficult processes.
Yeah, and I really love the fact that we're embracing the virtual world. It's really hard for family caregivers to leave their loved ones, and that's the biggest challenge we run into, right, Aaron? Is that you have family caregivers that can't escape and go leave them at home and come to an event like this because they don't have anyone else that can watch their loved one. This way they can digest it and be able to see it in their own home and be there for their loved one. And one of the things that Ann shared with me is that this will be available evergreen. It'll reside up on the DUET website. Is that the goal, Ann?
That's right. We keep our symposiums, our virtual symposium recordings, and our webinars available on the Meaning and Hope website, and also through DUET. They can reach them, the DUET website, and access them at any time. We know that times aren't always convenient for everyone, but we want everybody to have access.
No question whatsoever. I love the work that you're doing, and I know that you're having an impact on these families. I think the biggest challenge we run into is that so many think that they're all alone. They think that you can never understand what I'm going through, and it's really important to be around around others, support groups and environments like this, and feel like you're not alone. Feel like you are the silent army that is making a difference in people's lives.
That is so true. Isolation and loneliness is a national epidemic in our country, and it has significant health impacts. It's like smoking, one study showed, 15 cigarettes a day.
Right.
So for family caregivers who are isolated because they have no one to help them, we must find a way to reach them and give them community. And that's what DUET has designed into our Meaning and Hope Institute as a virtual community of healing and hope, where they can access all these programs and services that they need. They can, if they're caring for someone with dementia, they can access our signature workshop based on Dr. Pauline Boss's work, but also support groups, peer mentoring, personalized guidance. It's all there, a click away.
Well, I'll tell you what, you kind of teed up our fourth segment. I want to talk a little bit about the Meaning and Hope Institute so that everybody can learn and know that. And then I'm going to kind of close with Dr. Blight and ask him about some of the biggest challenges that are out there for family caregivers and some practical advice that he can give us. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I've got Ann Wheat, Executive Director from DUET, and I've got Dr. Aaron Blight here with me. Stick around. 3 down, 1 more to go. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back.
You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our fourth segment here. Wow, and time goes by fast here. So if you're just tuning in, I've got Ann Weed, Executive Director from DUET Partners in Health and Aging, and I've got Dr. Aaron Blight here with me in the studio, and he is one of our speakers at the Family Caregiver Virtual Symposium on Wednesday, October 18th. And it's from 9 to 11:30 a.m. Arizona time. Okay, we'll just say Arizona time because Mountain Standard Time, you know, they're an hour behind us. We're more right now on the Pacific Standard Time. So Arizona time, 9 to 11:30. And if you miss that, it will live evergreen up on the DUET website at duetaz.org. So I want to talk a little bit about something you teed up in the third segment, Ann. You talked about Meaning and Hope Institute. What is that?
I'm very glad you asked. So I will start by first framing the foundational program that has inspired us to develop the Meaning and Hope Institute. Many years ago, working with our family caregivers through support groups and our other services. As we know, Arizona has a very rapid aging trajectory. A lot of seniors, which predicts a high rate of Alzheimer's and related dementia diagnoses, and we have the highest in the nation. And what we've found is that more than half of the family caregivers who come to DUET seeking help and guidance are caring for someone with dementia. So we knew we had to do something about that. We were introduced to the work of Dr. Pauline Boss, who is the groundbreaking theorist on the complex grief that comes with caring for someone who's physically present but psychologically absent or missing. And the research shows that has the greatest impact on elevating stress for these family caregivers, more than the hard work, the hard tasks. So we've worked with her to create a video workshop series called Finding Meaning and Hope, because meaning and hope are essential to all human beings, and yet for family caregivers it can feel, in that situation where they can't fix what's wrong, it can feel hopeless and without meaning. And it has been now used, the series, for about 6 years, refined, tested, showing amazing results in lowering stress, improving caregivers' sense of competence, and they self-report that their health not only is improved significantly, but that of their loved one as well. To bring that forward then, after we learned from the pandemic, we virtualized that whole series and made it available. And now we have the only thing like it in the world, working with Dr. Boss. And so we wanted to start bringing that with the wraparound support systems. One workshop can help frame growth or whatever, but you need, as a caregiver, to always have access to those supports. And we really were worried about those who are isolated. So through the Meaning and Hope Institute, we are creating a community. Community can happen for isolated caregivers. Even though it's virtual, they can meet with and be with people who have our fellow travelers and get the help they need. They can click to all the supports right there.
And you can bring people in like Dr. Aaron Blight and Dr. Robert Wicks and Dr. Robert Waldinger and all these other folks just to complement the foundation that was created by Meaning and Hope.
Absolutely. And we really keep our focus primarily on Maricopa County and Arizona. We have so many people who may have help, but no resources in their small towns and communities. So we really want to watch out for all those family caregivers, give them options. Anyone can go to the site. It's still under kind of a work in progress, but it's coming along. And we are DUET partners in health and aging. We do everything by partnering, and the same is true here. Word of it is spreading, and in 2 years, really through word of mouth recommendations, we are now not only across Arizona on the Navajo Nation working with Spanish-speaking family caregivers, but also in 13 states. We have trained facilitators to bring this program to their caregiving communities. We're in Canada, and we've now just been contacted by someone in Australia who hopes to bring this to the caregivers of Australia, and we'll have that conversation next week.
And you're also on these higher education campuses like USC and others, and that
We
USC one is a big one.
This is a program designed to be run wherever a group of family caregivers can gather. We teach facilitators to run it in person, but also virtually, which is the majority of our sessions. And the beauty of that is anyone, anywhere can join a session. We had something like 13 or 16 sessions going all across the state and the country. So there is an opportunity for everyone. The wraparound support services are so important because they stay with you on that roller coaster ride. So we have peer mentors who have been on this journey and will be paired with a new caregiver. We have support groups that are there for them throughout their journey.
So just real quick, meaningandhope.org. That's how you're going to find out more about respite for family caregivers and all the tools and caregiving workshops that are available. I've got a little less than 2 minutes left, and, I want to kind of punt it over. You like my football metaphor? We're in football season. To Dr. Erin Blight, so what do you see, Dr. Blight, as the biggest challenges for family caregivers, and what practical advice can you offer from your book when caregiving calls guidance as you care for a parent, spouse, or aging relative that you could leave with our listeners?
Well, Bob, I think that Anne really hit the nail on the head just a minute ago when she was talking about the inherent stress that caregivers confront on a daily basis. And that stress is not only physical, it also can be emotional. It's a result of the decline of your loved one, and especially when you're talking about a person who has dementia, the ambiguous loss that Dr. Boss referenced and wrote about and studied. And that can have such an impact on your mental, emotional, and physical health. And I am a huge advocate for caregiver support groups. So getting involved with DUET, either online or in person with these caregiver support groups, being able to access an evidence-based program that truly does support and help caregivers would be at the top of my recommendations.
Love it. Absolutely love it. So as we wind down, what other last advice can you give our listeners? Anne, Erin, please take it.
I would say that you're not alone, and to seek out some help, either from a caregiver support group or professional counselor. This is a difficult situation, and reaching out can make a big difference.
And I would say no one can do it alone, and reach out. Take a first step and just give us a call or check out a website. There is help and hope, and meaning can come back into your life.
I love it. So if you want to call 602-274-5022 or go to duetaz.org. Can't thank you enough, my friend Anne Wheat, Executive Director of DUET, Partners in Health and Aging, and my new friend, Dr. Erin Blight. Make it a great day. Have a great weekend. We'll be back next week.
If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.